occupancy in Canadian hospitals is always extremely high. So we typically run around 95% occupancy.
The number of patients we're seeing is growing. The acuity of patients is growing, quite frankly. They're sicker when they come. They need more attention. They need more care in the community after they leave the hospital.
We had overcrowding, patients in the hallway, high occupancy rates that we felt led to a poorer patient experience and probably less quality outcomes. Our vision statement was to be an academic center that was tops in the country, leading in research and education, and it was glaringly obvious at that time that we didn't have a patient focus in our vision.
When the patients are not being able to flow to the hospital effectively, and you could argue the patient is not receiving the level of care we'd like to deliver by making sure that there's a space available for them at the appropriate level, at the appropriate time.
Physicians and other healthcare providers are knowledge workers. We need to push them up the value chain so they're not doing low value activity like calling for consults or trying to negotiate an admission for a patient on another service with another physician. And they should really be focused on patient care and their clinical delivery of care.
And over the course of a few months with a lot of engagement, we all agreed on a vision that we would aspire to provide each and every patient with the world-class care, exceptional service and compassion that we would want for a loved one.
So what we're doing is we're following the patient and we're modeling the processes that's relevant to them. And that's what we're attempting to do here, is to put process orchestration, process models in place so that literally from a monitor, you can see the characteristics of the system. You can see that the flow in the ED is too fast to be taken up in the admitting units in the inpatient wards. How can you influence that?
I think introducing business process management into healthcare is going to change the world, frankly. Being able to drive out the inefficiencies, to free up clinicians to do the things they ought to be doing for the patients, it helps to provide better care.
The concept is that we fill in using technology and tools the white space between the systems so that we can put markers in to know movement of a patient, critical events that need notification, bring in data where it's required proactively. And using the IBM tool sets, Lombardi, BlueWorks Live, and these other event engines, business rules engines, what we're doing is we're drawing what people do naturally out of their heads, looking at best practices, trying to meld those together to be best practice, and then model it and harden it so that it's predictable and usable. Process innovation is being able to introduce enablers like technology, like information, like other things into a process and make it more powerful. Increase the capacity of a process and flexibility of a process.
Either going to spend more time focusing on the right things and less time focusing on the mechanics, the bureaucracy, the paperwork and other things. I'm not spending time chasing information, I'm spending time dealing directly with the patients. The future of the Ottawa Hospital, from my point of view, is going to involve leveraging this technology across the entire organization. Obviously, we're starting small to begin with, but I can easily see it's going to spread further and further and further.
What I would like to see, and I will retire a happy man, when every patient, every time, walks out of this hospital having been treated and says, they treated me like a loved one and I've had a very good outcome. That's what this is all about.